height if I told you there are three nutrients that could actually help your blood sugar, and one of them you might already be low in? Would you want to hear about them? Good, because in the next few minutes, I'm going to walk you through the top three supplements people with diabetes should seriously consider, why they matter, what the evidence actually says, and how to take them safely. So you don't make things worse. No hype, just practical evidence-based advice. First, let's be honest, food, weight, exercise, and medication are the heavy hitters for blood sugar control. Supplements aren't magic, but they can play a supportive role, especially when someone is deficient. I'll start with the one that shows the clearest association with insulin sensitivity, and that's vitamin D. Low vitamin D levels have been linked to higher insulin resistance and a greater risk of developing type 2 diabetes. Several recent meta-analyses and trials suggest that supplementing vitamin D in people who are low can improve fasting glucose and insulin resistance markers. The effects aren't enormous, but they're real enough to matter for people who are deficient. How does vitamin D help? It's not a blood sugar drug. It works through a few mechanisms. It may improve how insulin producing cells in the pancreas work, and it can reduce systemic inflammation that interferes with insulin signaling. That's why I tell patients, check your vitamin D level first. If it's low, correct it under your doctor's guidance. Typical repletion regimens vary, but common safe approaches use cholecalciferol, vitamin D3 with a follow-up blood test after a few months to avoid overshooting. Don't self-prescribe megadoses without medical advice. The second nutrient I talk about with nearly every diabetic is magnesium. Magnesium is a mineral, not technically a vitamin, but its role in glucose metabolism makes it essential to mention low magnesium is common in people with insulin resistance and type 2 diabetes, and multiple meta-analyses show that magnesium supplementation improves fasting blood glucose and some measures of insulin sensitivity. The effect sizes are modest but clinically meaningful, particularly if you're low to begin with. In other words, if your magnesium is low, supplementing can actually lower fasting glucose. Foods rich in magnesium, like leafy greens, legumes, nuts, seeds, and whole grains, are the first recommendation. If you can't get enough from food, a supplement around 200-400 milligrams of elemental magnesium per day, depending on your baseline and kidney function, is commonly used, but again, check with your provider. Important safety note: if someone has impaired kidney function, magnesium supplements can accumulate and cause harm. So test kidney function before starting. Now, the third supplement is where the evidence gets mixed, but still interesting: chromium. Chromium isn't a vitamin either. It's a trace mineral, and a number of randomized trials, meta-analyses have shown chromium supplements can modestly reduce HbA1c and fasting glucose in some people with type 2 diabetes. The size of the benefit varies between studies and depends a lot on the chromium form, dose, and who's being treated. So yes, chromium can help in certain patients, but it's not a guaranteed fix. If you consider chromium, use clinically studied forms like chromium picolinate and don't exceed recommended doses. Also be aware that some recent expert commentary has questioned the overall benefit of chromium and the general population, meaning this is a targeted, not universal recommendation. Talk to your clinician about whether it makes sense for you. I also want to call out vitamin B12 here, not because it lowers blood sugar, but because it's hugely important for people on metformin. Long-term metformin use commonly reduces B12 levels, and untreated B12 deficiency can cause neuropathy that mimics diabetic nerve damage. So while B12 won't lower glucose, monitoring and treating B12 deficiency is a must for many people with diabetes, and supplementation is straightforward when needed. If you're on metformin, ask your doctor to check your B12. Okay, let's be practical for a moment. If someone watches this and says, which one should I start? Here's a sensible, clinician-friendly approach. First, get tested, check vitamin D, magnesium, if suspected low, and B12 if you're on metformin. If tests show deficiency, treat it. If you want to be proactive but your levels are unknown, prioritize vitamin D correction. If you're low in safe dietary changes to increase magnesium, those moves have the best balance of evidence and safety. Chromium is a more selective add-on for people who aren't reaching targets despite standard care, and it should be discussed with a clinician. Dosage and safety matter for vitamin D. Many clinicians use vitamin D3 and recheck levels. Dosing ranges from moderate daily doses to short-term higher repletion doses depending on how low you are. For magnesium, typical supplemental amounts fall in the 200-400 mg day range. But gastrointestinal side effects, especially diarrhea, increase with higher doses, and kidney disease is a contraindication. For chromium doses used in trials vary. Stick to trial products and avoid megadoses, and please do not combine multiple new supplements at once without supervision. We want to know what helps and what doesn't. Another important point, supplements are not risk-free. They can interact with medications. For example, chromium may affect insulin sensitivity and could change how much medication you need. Magnesium can affect certain heart and blood pressure medications. High vitamin D without monitoring can raise calcium. That's why I always say run this plan by your prescribing clinician. If you start a supplement, have a plan for follow-up labs so you know it's working and not causing harm. Beyond pills, don't forget the basics: weight loss. When indicated, physical activity, high quality protein, fiber rich foods, and minimizing processed sugar are the strongest, most durable ways to lower blood sugar. Supplements are a complement, not a replacement. Even the best evidence for vitamin D or magnesium shows modest effects compared to lifestyle change and approved medications. Because I know people want specifics, here's a short checklist you can take to your clinician. Check serum 2,5-hydroxyvitamin D and replete if below local cutoffs. Check magnesium if you have symptoms or risk factors, and consider dietary increases first. Check B12 if on metformin and supplement. If low, consider chromium only after discussing potential benefits and risks and under medical supervision. If you want, ask for baseline HbA1c and repeat it a few months after starting a targeted correction to see if there's meaningful change. Before I finish, two quick real-world tips. 1. Food. First, leafy greens, nuts, seeds, legumes, fatty fish, and sun exposure safely help your nutrient profile and reduce reliance on pills. 2. Buy supplements from reputable brands that provide third-party testing because quality matters. Some over-the-counter products have inconsistent dosing or contaminants, and that's the last thing you want. So let me wrap this up. Vitamin D, magnesium, and in selective cases, chromium are the top 3 nutrients I discuss with people who have diabetes and want to optimize blood sugar. And vitamin B12 is also essential to monitor. If you're on metformin because of the risk of deficiency and nerve damage, all of these should be considered as part of a broader plan that includes diet, exercise, and medication, and always done with proper blood tests and professional oversight. If you found this useful, do me a favor, hit like, subscribe for more practical evidence-based tips, and share this with someone who's managing diabetes. And if you want, drop a comment telling me which supplement you were curious about, and I'll dig into dosing, brands, and lab targets in the next video. Take care and talk to your clinician before starting anything new.